Hi friends. So now we'll discuss today another important question which ought to come in your exam for sure, and that is regarding the food poisoning, diarrhea, or somewhat they can ask it regarding the dysentery. Okay. Hello guys, you can ask up in the questions in the comment section and all. I am there. Now, first of all, you see this particular case scenario, and on the basis of these all, we'll discuss of the things. And the first thing is a 19-year-old man developed the acute onset of nausea, vomiting, and diarrhea. Okay. Shortly after returning from a picnic party, none of the food tasted spoiled as such. His symptoms started abruptly about an hour after he reached the home, which was approximately around 4 hours after the consumption of food. Okay. He had no fever, had not passed any blood in the stool or vomitus. It was informed that three other guests who attended the party also became ill with the similar features. Okay. So what we are talking about. So guys, in this type of case scenarios or questions, what becomes important is that is the incubation period. What is the incubation period of this particular case? So as it is given up in the question, it is around 4 hours after consumption of food. So that is clearly giving up a history that it might be due to Staph aureus, it might be due to the Bacillus cereus. Okay. But they have not told up properly. The question doesn't tell what clearly they have eaten up. So obviously they have attended a picnic party, so a lot of things they can eat up that particular party, or one particular thing is there which was contaminated in some sort that they have eaten up. Okay. So on the basis of incubation period and all, I will share up a particular table with you, according to which the questions might come to you that this much is incubation period, so this organism will do. This much is a incubation period, this organism will do. So like that. Okay. So this particular food poisoning, which we have talked about, as it have occurred within 4 hours, that is the short incubation period. So I told you two organisms you can think of. One is Staphylococcus aureus, and another one is what? Bacillus cereus. And in the Bacillus cereus also, which particular one, guys? The emetic type. Okay. Emesis type or emetic type means the vomiting will be there in this. That is, the emesis will be there in the Bacillus cereus emetic type. Okay. So that you need to know that these two, they come in the incubation period of less than 6 hours, and less than 6 hours is 4 hours. And that's why we say that this particular one can be Staph or it can be Bacillus cereus emetic. I do know. Right? So, first of all, before going to that particular list, you should know that what is the simple definitions of these particular things: diarrhea, gastroenteritis, dysentery, food poisoning. What exactly is a simple definition of them? Certain idea should be there with you. The passage of more than 3 times what? Loose forming stools. Loose stools more than 3 times a day. That is what is termed as what, guys? Diarrhea. Okay. As per WHO, this particular one, loose or unformed stool, that might be the definition of diarrhea. So passage of loose or unformed stools more than 3 times a day, that is what is termed as diarrhea. Gastroenteritis, as the name only suggesting itis. So itis means inflammation. Itis का क्या मतलब हुआ? Inflammation. Inflammation of what? Mucous membrane. Of what? Either the stomach or either the intestine. Enteritis. Resulting in what? Pain, fever, and tenesmus. That is incomplete evacuation, that feeling. So constant urge is there to remove that particular stuff. So that is termed as tenesmus. The pain, fever, and tenesmus, they associate with what? Gastroenteritis. As far as the dysentery is concerned, what is that? The diarrhea with increased blood and mucus. Okay, diarrhea with what? Increased blood and mucus. That is termed as dysentery. Okay, means what is the addition? Addition is blood. and along with that mucus also. But mainly it is blood because invasive they are, and because of that invasiveness, what happens? That is the blood comes. Okay. Then comes this particular word, food poisoning. And the food poisoning is what, guys? The illness acquired by consumption of food or any drink contaminated with the organism, that is a microorganism, obviously, and either their toxins. Okay, it can be the like bacteria might be there, and along with that, toxin might be present sometimes, or either way, it can be organism or the toxins. Because of that, what is there? Some illness, and that is being acquired by consumption of what? Food or drink. So these particular definitions, first of all, you should know. Okay, these particular definitions, first of all, you should know that what is diarrhea, what is gastroenteritis, what is dysentery, and what is food poisoning. Is it fine? Now, if we talk about this particular table, which is there from the Harrison, okay, so this clearly depicts up the organism name, and along with that, it happens by which particular food source. So that is very clear one, which is there. Hi Bharti, hi Gunjari, hi Jechan. Okay. So they will definitely give up. The person have eaten up what? So that will be helping you in the exam. Another thing which they will be giving up is regarding the incubation periods and all. Okay. So guys, as I told up, the first two, they are what? Less than 6 hours. Okay. Then this particular one, it is 8 to 16 hours. Okay, 8 to 16 hours. And the last one is for more than 16 hours. Okay. And what is this which I'm telling you? 6 hours, 8 to 16 and more than 16. That is regarding the incubation periods. That is regarding what, guys? That is regarding the incubation periods. Okay. So one by one, we'll see up which particular food source is related with which organism. Okay. And I will tell you some important points also besides that. Okay, guys. So first of all, you should know regarding the Staphylococcus aureus. The Staph aureus. In total, in a simple way, you can remember of any contaminated meat and milk product. Okay. Any contaminated meat and milk product. Contaminated meat and milk product. Okay. Contaminated meat and milk. So that is one of the things which associates with Staph aureus food poisoning. Which associates with what? Staph aureus food poisoning. It is being done by what? It is being done by antirotoxin. And the antirotoxin is which one, guys? Antirotoxin A. Okay. So first of all, let's see that what are the sources by which the Staphylococcus aureus food poisoning happens. किस चीज से होता है? Okay. So one is ham. You know the hamburgers and all. Poultry, bird products, potato or egg salad, mayonnaise, which you eat up with very interest, the cream pastries. So this particular question regarding cream pastries and all is being asked in the NEET PG twice. So this also you should be known that this cream pastries one, they have given up that somebody have eaten up from a party, date night party, and after 6 hours early morning starts having this vomiting and all. So which particular organism most likely associates? The answer is Staphylococcus aureus. So guys, if you see up, अगर question में लिखा हो क्या इन सब का नाम, like a hamburger somebody have eaten up, poultry bird products, potato egg salad, mayonnaise or cream pastries, तो हमें किसके बारे में सोचना है? We have to think for Staphylococcus aureus. Is it fine? Other than that, if we talk about the Bacillus cereus, the Bacillus cereus, which particular strain? Ematic strain. Okay, Bacillus cereus, ematic strain. Characteristic history is there of what? Chinese fried rice. Okay, Chinese fried rice, characteristic history will be there. And important is this is reheated Chinese fried rice. Okay, and here also they can say that these particular products which are there, they are heated one. Like somebody have eaten up heated paneer. Okay, in a marriage and all. शादी में गए, पनीर खाया, वो भी बड़ा गर्म, लेकिन उसके बाद भी फूड पॉइजनिंग होगी. Even after that heating, the food poisoning happened. So that suggests what? That is a heat stable toxin. So remember, here also it is reheated in the Chinese fried rice one, and here also it's reheated stuff. In them also they survive. And that suggests what, guys? That suggests that it's a which sort of a toxin? It's a heat stable toxin. Okay, it's a which sort of a toxin, guys? It's a heat stable toxin. Okay, it's a heat stable toxin. Fine. So remember this particular aspect also, that this is the heat stable toxin. You're able to see up this particular table, or I should zoom it? If you're finding a difficulty in seeing up, then I can zoom that. Okay. I think the landscape you can see it properly. Fine. So if it is being talked about the Chinese fried rice, that from a roadside vendor you have eaten up Chinese fried rice, and after that the emesis and vomiting happened. So that is Bacillus cereus and Staphylococcus aureus after attending a marriage and all. Regarding the Clostridium perfringens. So guys, you know the Clostridium perfringens mostly does what? Gas gangrene. But yes, here we are talking about what? We are talking about the food poisoning. Okay, we are talking about what? We are talking about the food poisoning. So Clostridium perfringens also associates with what, guys? It also associates with food poisoning. Okay, Clostridium perfringens. And which particular type of Clostridium perfringens associate with that? That is the type A. Okay, type A alpha toxin. Okay, type A alpha toxin, the same one which does gas gangrene, also associates with food poisoning. And the organism is Clostridium perfringens, whose type is type A alpha toxin. And what all is being eaten up? Contaminated beef, poultry bird products, legumes, gravies, they all associates with what? They all associates with Clostridium perfringens. Is it fine? With the help of 3-4 tables only, I will tell you that how to handle up this food poisoning stuff and diarrhea along with dysentery. Okay, along with few tables itself. So if you listen up to this, most of the things will be covered of yours. So Bacillus cereus, diarrheal one. If we talk about the Bacillus cereus, diarrheal one, that is obviously which is mainly doing the diarrhea, because the previous one is emesis, that is the vomiting and all, emesis, and here it is diarrhea. Is it fine? So this one associates with eating of what? Contaminated meat, vegetables, dried beans, cereals. So that is regarding the Bacillus cereus diarrheal one. Okay. And the Bacillus cereus hematic one, I told you, the typical history of what? Chinese fried rice. Typical history of what? Chinese fried rice. Okay. Now, coming to those which are more than 16 hours. Vibrio cholerae. Vibrio cholerae infection mostly happens in the form of epidemic. But yes, these can also be the contributors, obviously the shellfish. Contaminated shellfish or contaminated water that you already know. Enterotoxigenic E. coli. Enterotoxigenic E. coli. This particular ETEC, what is the short form of it? It is termed as ETEC. Okay. And if you have done all your studies and all, you must be knowing this also कि enterotoxinic E. coli किसके साथ associate करता है? It associates with traveler's diarrhea. Okay. A person who travels frequently to different countries suffers from what? Suffers from traveler's diarrhea. And there, that particular individual eats up the local food and lands up with what? Diarrhea. So enterotoxinic E. coli, this particular one associates with traveler's diarrhea. Okay, this associates with what? Traveler's diarrhea. And in fact, this is the most common cause of traveler's diarrhea. In fact, this is the most common cause of traveler's diarrhea. Which one? Enterotoxigenic E. coli. And the infection of this happens by eating of what? The salads, cheese, meat, contaminated water. So all this associates with what? Enterotoxigenic E. coli. So one thing is for sure, guys, mostly it is the contaminated vegetables along with contaminated meat. That is most, if you tend to forget also, no, that what is there, you can write anything of that sort. Okay. So that will help you to write up in the exam that exact thing. Okay. If you don't know, then you can write these at least. Fine. Enterohemorrhagic E. coli. Enterohemorrhagic E. coli. Another important E. coli which does the problem, that is O157H7. And O157H7, if you have really studied well up till, you must be knowing also. O157H7 is what? O is somatic antigen, H is flagellar antigen, and this particular serotype leads to HUS in the children. And what is HUS? Hemolytic uremic syndrome. Okay, and the infection of this happens after what? Eating up this contaminated beef, roasted beef, salami, raw milk, raw vegetables, and apple juice. And obviously, that apple juice is contaminated. The one thing is for sure that here also the same story, contaminated vegetables along with contaminated milk products. Okay, regarding the enterohemorrhagic E. coli also. And I told you that which particular one is there, guys? That is O157H7, which leads to what? That is HUS in children, and it can lead to hemorrhagic form of a diarrhea in the adults. Okay, hemorrhagic form of diarrhea in the adults. Now talking about the Salmonella. Salmonella, which Salmonella? Non-Salmonella typhi. So you can call it as what? NST. What you can call it? Non-Salmonella typhi. Associates with what? Beef, poultry products, eggs, dairy products. So that is regarding the Salmonella. And which Salmonella? Non-Salmonella typhi. Is it fine? Then talking about this Campylobacter jejuni. So have you heard of this name, guys? Campylobacter jejuni. If you have not heard of, then you should be knowing it, because the question definitely will be coming in the exam regarding the Campylobacter jejuni. And this time in the NEET PG, this question came just now. Associates with what? Contaminated poultry products along with the contaminated raw milk. Okay, obviously unpasteurized raw milk. That is one of the etiology by which Campylobacter jejuni infection it ought to happen. And here also you can add upon the contaminated water, because the same thing happened up in the Pune, that after having the contaminated water, the infection of Campylobacter jejuni happened. And in the exam, in the NEET PG exam, the question came regarding the raw milk. That somebody have eaten up drunk up the raw milk, unpasteurized milk, and landed with some infections in which blood is also coming up. That means it's a sort of dysentery in this particular Campylobacter jejuni infection. Okay, and along with what? The poultry bird products. That is the eggs and all, along with all other products of poultry. That also associates with what? Campylobacter jejuni. Okay, Campylobacter jejuni is an organism in which, suppose a question comes regarding the MCQ of Campylobacter jejuni, you should remember that this is the only organism which loves to grow at 42 degrees centigrade. Okay, I'm just telling up because it might come in the form of some MCQ. So how to catch up that particular MCQ? Catch up that MCQ with this temperature stuff. 42 degrees centigrade if it is written up. This is the only organism which loves to grow at 42 degrees centigrade. And how to remember it for lifetime now? Remember like this, that this is which camp? This is summer camp. Okay, this is which camp? This is summer camp. Fine. And summer camp is having a temperature of how much, guys? It is having a temperature of 42. Okay. Now talking about the Shigella. The most common cause of bacillary dysentery is Shigella species. Everybody knows it, I suppose. Okay. Associates with potato or egg salad. The similar story of staph. Lettuce, raw vegetables. The similar story. Okay. That is regarding the Shigella. And Vibrio parahemolyticus. Another favorite question which is coming again and again, and definitely in the prof exam, it can come in the form of MCQ. Vibrio parahemolyticus is 7% halophilic. Okay. This particular one is what, guys? It is 7% halophilic. Means it loves the salt. and associates with what? Contaminated mollusk and crustaceans. Okay, contaminated mollusk and crustaceans, and mostly they say that is the oysters. Okay, contaminated oysters that is being eaten up, and the patient lands with what? Seafood poisoning. The patient lands with what? Seafood poisoning. Okay, the patient lands with seafood poisoning. So that also should be remembered regarding the Vibrio parahemolyticus. So this particular table itself is full of questions, guys. They can give any of these things and they can ask according to the incubation period that which organism we are talking about and what is the likely DD which you can make if the incubation period is this. So guys, again, I'm telling up, if it is less than 6 hours, Staphylococcus aureus and Bacillus cereus. If it is between 8 to 16 hours, then it is Clostridium perfringens, Bacillus cereus, Diarrheal one, Vibrio, cholerae, and down. They come in the list of more than 16 hours. From the Vibrio cholerae, the incubation period starts how much? More than 16 hours. And what is that? Toxigenic E. coli, other than Vibrio, enterohemorrhagic E. coli. So two most important E. colis. The names of them you should know. One is enterotoxigenic and one is enterohemorrhagic. Along with that, Salmonella, Campylobacter jejuni, Shigella, and Vibrio parahemolyticus. And this Vibrio parahemolyticus, guys, they can ask up. It associates with seafood poisoning. And nowadays they are asking a question that which particular phenomena is observed in this. So there is a phenomena which is being observed, and that phenomena name just you remember up, and that is Kanagawa phenomena. And what is Kanagawa phenomena? It is enhanced beta hemolysis. क्या बोलते हैं उसको? Enhanced beta hemolysis. अब तुम्हें beta hemolysis का मतलब पता होना चाहिए. क्या होता है beta hemolysis? Complete hemolysis उसको बोलते हैं. और Kanagawa phenomena जो है कौन दिखाता है? Vibrio parahemolyticus. Okay. So ये भी पूछा गया. तो this can also be asked. और कैंप के बारे में याद रखना बॉस. और कैंप कौन सा कैंप है? समर कैंप. और समर कैंप का टेम्परेचर कितना है? 42 डिग्री सेंटीग्रेड. व्हाट इज द टेम्परेचर? 42. Toxigenic, T for T. The most common cause of traveler's diarrhea is enterotoxigenic E. coli. Or hemorrhage is happening, boss. Okay, and if you remember, apple juice is red only, na? So relate that. Enterohemorrhagic E. coli associates with contaminated apple juice along with these particular stuffs. That is beef, roasted beef, salami, raw milk, raw vegetables. All these they associates with what? All these they associates with this enterohemorrhagic E. coli. And the Salmonella is not Salmonella typhi. It is non-Salmonella typhi. Non-Salmonella typhi means what, guys? Non-Salmonella typhi means Salmonella typhimurium and Salmonella enteritis. These are there which associates with this gastroenteritis or food poisoning. Is it fine? And Campylobacter jejuni, raw milk, poultry birds, and the contaminated water also. Another important thing regarding Campylobacter jejuni is summer camp 42. Another is it have a very strong association with GBS. And what is GBS? Guillain-Barré syndrome. Okay, Guillain-Barré syndrome. Which one is having a strong association? Campylobacter jejuni. Is it fine, guys? So this particular table is a storehouse of lot of questions. Definitely they can give us case scenario according to this, and they might ask you in the exam. Is it fine? Now, other than that, there is one table which no need to remember full. Just you should know the basic idea of it. That how many forms of diarrhea are there? So three forms of diarrhea are there, guys. One is non-inflammatory, one is inflammatory, that is invasion due to a cytotoxin. Okay, so that is inflammation is happening. What is the meaning of non-inflammatory, inflammatory? The meaning of this is non-inflammatory means that there is no invasion and all. There is no fecal leukocyte seen in the stool sample. That is the meaning of non-inflammation. And inflammatory means there is an inflammation. You will get the fecal leukocytes. So that is the logic of inflammatory one. Okay. One more type is there that is termed as penetrating. Okay. Invasive, penetrating, they are more like same, but the change is regarding the location. The change is regarding the location. Okay. Again, I'm telling up some of the examples you can remember of. Not all names, you will not able to remember all names for sure, but at least some of them you can definitely remember. Okay. Now, non-inflammatory one. See, what is the location of non-inflammatory one? The location is proximal small bowel. Okay. Proximal small bowel is for the non-inflammatory fellows. And what they mostly do? Watery diarrhea. What they mostly do, guys? They do watery diarrhea. There is no blood and all. There is a watery diarrhea. And in the stool finding, you observe, see what? There is no fecal leukocytes. Okay, there is no fecal leukocytes, or because of that, the fecal lactoferrin, that is also not increased in this particular entity, that is in the non-inflammatory one. Okay, so firstly, you should know the location, that is proximal small bowel. What happens? Watery diarrhea. And if you go for the stool findings of this particular one, inflammation is not there. So obviously, what should not be there? There should be no fecal leukocytes. Okay. And the fecal lactoferrin, if you go for the testing of this, that is not increased. Fecal lactoferrin is not increased. Is it fine? Now, which all bacteria are there which does this non-inflammatory diarrhea? Okay. So guys, the bacteria, if somebody asks you regarding the non-inflammatory one name you should not forget, and that name is Vibrio cholerae. Okay, that name is what? Vibrio cholerae. Other names, if you remember or not, doesn't matter. But one name जो आपको भूलना नहीं है, जो लिखना है, अगर नॉन इन्फ्लेमेटरी वाले आप बता रहे हो, जो कि क्वेश्चन भी आ सकता है, तो विब्रियो कॉलरे का नाम डेफिनेटली आपको याद रखना है. डेफिनेटली आपको याद रखना है किसका नाम? विब्रियो कॉलरे. फाइन. और दूसरा नाम याद रखो इकोलाई. लेकिन इकोलाई में कौन? एक एंटीरोपैथोजेनिक जो कि बच्चों में होता है, पीडियाट्रिक एज ग्रुप P4P करके याद रख लो. और दूसरा होता है एंटीरोटॉक्सिजेनिक. अभी हमने पढ़ा क्या कर रहा था? ट्रैवलर्स डायरिया. और एक इसका भाई है एंटीरो एग्रीगेटिव. So basically in the E. coli, three things are there. One is enteropathogenic, enterotoxigenic, enteroaggregative. I will speak Hindi, English both. Fine. So don't be in a bias that Hindi and English is there. So both the things I will repeat up. Enteropathogenic, enterotoxigenic, enteroaggregative. That is there. Three names. And they associate with which form of diarrhea, guys? Non-inflammatory form of diarrhea. And what is the basic finding in them? There is a watery diarrhea. There is a watery diarrhea. All other names, this is the most important, and Bacillus cereus. Bacillus cereus and Staphylococcus aureus. These two names, which we have just done, na? Can you tell me in the comment section if you are there, then how much is the incubation period of these two fellows, Bacillus cereus and Staphylococcus aureus? इनका incubation period कितना था? Staphylococcus और Bacillus cereus का, जो हम इस पर्टिकुलर नॉन इन्फ्लेमेटरी वाले चैप्टर में पढ़ रहे हैं, मतलब नॉन इन्फ्लेमेटरी वाले सेक्शन में पढ़ रहे हैं. Yes, anybody? Can anybody tell that how much is the incubation period of them? So guys, just now I told you that is less than 6 hours. That is less than 6 hours. So this, like this, you should know that this is non-inflammatory form diarrhea, means in them also which sort of a diarrhea will happen? Watery diarrhea. So Bacillus cereus, Staphylococcus aureus, Vibrio cholerae, and E. coli. These four names you should know. Rest of all you can forget. Okay, rest of all you can forget. These are the bacteria which does watery diarrhea. The most important virus, in fact, the most common cause of diarrhea in children is rotavirus. The most common cause of diarrhea in children is rotavirus, that you know, and in that also which sort of a diarrhea happens, guys? Watery diarrhea. Okay. Another one is norovirus. And the norovirus name, it can be asked in the form of MCQ. That somebody have gone on a ship cruise, and after going on the ship cruise, that particular individual develops the diarrhea. And that sort of diarrhea is what? The watery diarrhea. So remember this thing also, guys, that this watery diarrhea of norovirus, which happens to be due to what? The ship cruise journey. That can also be asked. So remember like this, who have gone for the ship cruising? Noro. Noro have gone for the ship cruising, and rotavirus is the virus which associates with the diarrhea in the children. And that is the most common cause. All others you can forget upon. Rota and Noro, that should take from the viruses. As far as the parasites is concerned, guys, in the parasites, you have the name of Giardia lamblia. And that particular one is a intestinal flagellate. What it is? It is a intestinal flagellate. Along with that, you can remember of the Cryptosporidium, Cyclospora, Cystoisospora. Okay, these three names. So, guys, if you're a second year student, you will find these names again and again. Okay, so this is what I'm telling you. First of all, now this should be very clear in your mind that what we are talking about. Because what I'm finding, because this is competency based new curriculum, what have happened अब कि ज्यादातर स्टूडेंट्स को यही नहीं पता कि पैरासाइट कौन सा है, वायरस कौन सा है और बैक्टीरिया कौन सा है. Okay, lot of students they don't know that what is a bacteria, what is a virus, and what is the parasites. So if you don't know the basic, then how you will make a good foundation. So for this only, I suggest that we have a MBBS curriculum competency based only, but I have fortified the things that is your base by telling first in an intelligent way that which are the bacteria, which are the fungus, which are the parasites. If you able to recall that only proper, then half of your tension is gone. Okay, and in 3 hours only you can able to know this by our app. That is our DocTutorials MBBS curriculum app. So if you able to see that in 3 hours only, you will be so confident that you will able to recall up most of the things of the microbiology. So I strongly recommend that you should know first the names of the bacteria, viruses, and parasites, which I've told up, and then you can go for the system-wise approach. Okay, that will be an intelligent step rather than going directly and seeing like that. That will be a problem always to remember the things. Okay, guys. So this one we have talked about what? This is non-inflammatory form of diarrhea. So if a short note comes on the non-inflammatory form of diarrhea, you have to tell what? Which particular portion is involved? That is a small bowel. Which sort of diarrhea happens? Watery diarrhea. And what are the stool findings? These are the stool findings. There is no fecal leukocytes, and these are the bacteria, Vibrio cholerae, E. coli, Bacillus cereus, Staph aureus. In the viruses, it is Rota and Noro. And in the parasites, Giardia lamblia along with triple C. And what is triple C? They are coccidian parasites. And why they are important? Because in HIV positive, they does massive diarrhea. And you can ask your seniors that in every exam that is being asked. In every exam, the Cryptosporidium, Cyclospora, Cystoisospora is there. Okay. Now talking about the inflammatory one. Inflammation, when it will happen? When it invades and secretes up cytotoxins. So here the location you see, that is mostly the colon or distal small bowel. That is the location in which the upper one it is proximal and now it is distal. Okay. And here, you know that invasiveness means what? Blood is coming. So that is dysentery. And what will happen? Inflammation. And what will be finding in the stool sample? Fecal leukocytes. So remember this, that here, what you will find, guys? You will find fecal leukocytes. Because inflammation is happening and you know inflammation is happening. So what will come in the stool? This fecal leukocytes. And here, as I told you, diarrhea mostly doesn't happen. Dysentery happens. The dysentery diarrhea, what is the difference? Blood comes in dysentery. And the most common is shigellosis. That is a Shigella. Shigella flexneri, Shigella soni, number of species of them are there. Campylobacter jejuni. So if you are in the comment section, can you tell me, guys, Campylobacter jejuni loves to grow at which temperature? So Campylobacter jejuni is the curved rod which loves to grow at 42 degrees centigrade, because this is which camp? This is summer camp. This is which camp? Summer camp. And Campylobacter jejuni. What was the organic things by eating up what this thing happens? The contaminated poultry bird products. Along with that, raw milk and contaminated water. Associates with which particular syndrome? GBS, Guillain-Barré syndrome. Enterohemorrhagic coli, O157H7. This name you should not forget. Associates with what? Associates with HUS. That is hemolytic uremic syndrome. Enteroinvasive E. coli. Another E. coli. Enteroinvasive E. coli. This Mimic which particular disease, guys? This mimics shigellosis. This particular thing mimics what? Shigellosis means what? Bloody diarrhea. In the diarrheal sample, the blood will also come. And see this name, Vibrio parahemolyticus. This can be having blood sometimes, not always, sometimes can be there with the Vibrio parahemolyticus. And I told you how much percent halophilic that Vibrio parahemolyticus is? 7%. Okay, and which phenomena I told you? Kanagawa phenomena. Which phenomena? Kanagawa phenomena. And as far as the parasites are concerned, guys, the parasites is Antamoeba histolytica. The name is only suggesting histo, cell, lysis, histolytica. So there is a diarrhea along with blood. So that is dysentery. The most common cause in the case of parasites is what? Antamoeba histolytica. And another one is Bacillus coli, which is also termed as the largest intestinal protozoa, which is also termed as what, guys? Largest intestinal protozoa. Is it fine? So this is regarding what? Inflammatory, invasion or release of what? Cytotoxins. Okay, you have to revise it once. When you revise it, you will feel the difference yourself, for sure. Okay. Now, not confusing you much, come to this. That is a penetrating one. In the penetrating one, that is more like invasive only, but location somewhat changes. This is again same like distal small bowel, and enteric fever is an example of this. Enteric fever is an example of this, and as you can see, the fecal mononuclear leukocytes, they increase here rather than poly. Mononuclear leukocytes, they increase up in the penetrating one. And obviously, we're talking about enteric fever. So obviously, what comes in our mind? Salmonella typhi. Okay. So Salmonella typhi is a sort of a disease in which diarrhea can also happen and constipation can also happen. If the diarrhea is happening, that is a penetrating type. Salmonella typhi, which is a causative agent of what? Enteric fever. And another one is Yersinia enterocolitica, which also is a typhoid-like illness. Yersinia enterocolitica. So these at least 4 or 5 names. If you could not able to remember everything, at least one name out of this particular list, you should know. Okay, so we have talked about what? 3 things. One is watery diarrhea, non-inflammatory, then inflammatory, and one type they have told a penetrating one. So that penetrating one, typhoid fever. You remember penetrating one is regarding the typhoid fever, enters the mucosal cells and all that, you know now. That is bacterial mediated endocytosis and all that particular one that you observe. So that is the penetrating one. But overall, you remember 2 things. Non-inflammatory, inflammatory. Non-inflammatory means no fecal leukocytes. Inflammatory means fecal leukocytes are observed. Simple. Okay. Now, guys, you should know something about these particular organisms. Important one we'll discuss, not all. Okay. The various organisms which associates with causing of what? The diarrhea or dysentery. One by one. The things which we have discussed up, we will relate them with this. Okay. So first of all, if I tell something about the Vibrio cholerae. Okay, Vibrio cholerae in a nutshell, if I have to tell you, then what is regarding Vibrio cholerae? Just now we have seen it does non-inflammatory form of diarrhea. So it is a watery diarrhea. It is which sort of a diarrhea, guys? Watery diarrhea, and it is due to a toxin. It is due to a toxin which is made up of 2 components, A and B. Most of the toxin is made up of A and B. B helps in binding, and A does ADP ribosylation, okay, of G stimulatory protein. I suppose you must have done in your classes this particular one. And finally, what happens in Vibrio cholerae stuff? Watery diarrhea, why does it happen? Because there is an increase in what? Cyclic AMP. There is an increase in what? Cyclic AMP, and thereby massive rice watery stool that is happening in the Vibrio cholerae. So if in the exam you are getting up the story of rice watery stool, then you should think for whom? Vibrio cholerae. Is it fine? So guys, what are the important things which you can write up if this particular question comes regarding Vibrio cholerae? So one thing is that the toxin, and this particular toxin is having 2 components, A and B. B helps in binding, and A does ADP ribosylation of G stimulatory protein. And thereby there is an increase in what? Cyclic AMP. And because there is increase in cyclic AMP, what happens? Rice, watery stool. Is it fine? Now, this Vibrio cholerae is having which sort of a motility? Darting motility. Which motility is observed? Darting motility. Now, in the labs, how to identify Vibrio cholerae? That is also a problem now. So, how to identify? With the help of the hanging drop. Okay, you do a particular procedure, and that particular procedure is termed as what? Hanging drop. And by the hanging drop, this, what you observe under the microscope, that there is a shooting star like motility, and that is termed as darting motility. This particular organism, Vibrio cholerae, is a comma-shaped gram-negative bacteria. Okay, so that you can find in the gram stain also. Comma-shaped gram-negative. Catalase and oxidase positive. These two tests are positive in the Vibrio cholerae. Catalase. Catalase, guys, yaad agar tumhe ho, so what is catalase? 3% H2O2. And then you add the colony. Bubbles, they come. And regarding the oxidase, what is there? There is a white color strip which is having oxidase reagent. And when you touch that, the color changes from white to blue within 10 seconds. So that particular thing is termed as what? Catalase and oxidase positivity. And the most important thing which you should write as in the identification feature of Vibrio cholerae, that is TCBS agar. And what is TCBS stands for? Thiosulfate, citrate, bile salt, sucrose. Thiosulfate, citrate, bile salt, sucrose. And this sucrose is fermented, and thereby which sort of colonies they produce by Vibrio cholerae? That is yellow colored. And actually it is which colored media? Green changes to yellow because of the sucrose fermentation. So that you should tell in your story whenever it comes as a question. Eye cut test you can forget upon because nobody is doing it, and it is not worthwhile to remember the eye cut test of this particular one. And what is this eye cut? Indol, citrate, urease, okay, TSI. So this is not worth of it. So you can forget upon this. Okay. Now, suppose a particular colony have grown up and that have agglutinated with what? Vibrio cholerae oven antisera. Okay. So oven antisera, if it is agglutinating, so obviously which antigen is there in that particular one? Oven antigen. So this is suggesting up that which particular Vibrios we are talking about. We are talking about oven Vibrios. Okay. Oven Vibrios. And in the oven Vibrios, two names are there. One is classical and one is Altor. One is classical and one is Altor. Okay. So they are termed as oven Vibrios. How we know that they are oven Vibrios? Oven is a antigen, somatic antigen. And when we agglutinate that particular sample with Vibrio cholerae oven antisera, there is agglutination happens. Okay. If that agglutination happens, that means in that particular one, what is present? Oven Vibrio. Oven antigen is there, and that is oven Vibrio. Which are oven Vibrios? One is classical strain of it, and one is the Altor. For that, you have to study the book also. Okay. If you are finding that what is Altor and classical, you don't know that, that means you are not studied. Okay. So they are oven Vibrios. And what are the non-oven Vibrios? Which are O2 to oven 39. They are termed as non-oven Vibrios. So guys, the crux of the things is, if the Vibrio cholerae question comes, you have to explain up the cholera toxin, how does it works upon. You have to tell about the darting motility. You have to tell about the shape of it, comma shape. You have to tell it is catalase and oxidase positive. And you have to tell about the best selective media for that. That is the TCBS agar. And TCBS agar stands for what? Thiosulfate, citrate, bile salt, sucrose. And you can do further to identify agglutination with what? Vibrio cholerae oven antisera. Is it fine, guys? So these 3-4 points, at least if you're able to recall up, that is also good for you. Now, if we talk about the Shigella, so guys, I told you the most common cause of dysentery as per the bacteria is what? Shigella, shigellosis. And it's a gram-negative bacilli. It's a gram-negative bacilli. And this one is non-motile. It is written there motile. It is non-motile. This is the most important property of it, that this is non-motile. And how you remember that? Remember by this particular name, illa. Okay, illa means no, it is not motile. So it is non-motile. Remember this particular one. Catalase positive, but oxidase negative. Catalase positive, but oxidase negative. And when you try to grow this on MAC, what is MAC? Is it apple mac? It is MacConkey agar, short form. MacConkey agar, you must have heard of. Or deoxycholate agar. DCA stands for what? Deoxycholate agar. And on that, there is a non-lactose fermenting colony. And what is termed as NLF. Non-lactose fermenting colonies. They are observed in the MAC or the DCA. And what is the DCA full form? Deoxycholate agar. As far as this XLD is concerned, what is XLD? Xylose lysine deoxycholate. And here it is red color. Okay, red X. Red color colonies are there without what? Without black center. Okay, red color colonies without black center. That is again illa, without. That is without black center. That is XLD. I cut here also you can forget upon. And this also agglutinates with what? Shigella polyvalent antisera. This can also agglutinate with what? Shigella polyvalent antisera. That is regarding the Shigella. And this is the most common cause of bacillary dysentery. Okay, this is the most common cause of bacillary dysentery. Now, talking about the Salmonella, and that too, which one? Inflammatory type. Okay, inflammatory type, that is the penetrating type. I told you, no, penetrating one. So that comes as a subheading of inflammatory only. Gram negative bacilli. Yes, Salmonella is gram negative. It is motile. Yes, it is motile. Catalase positive. Oxidase negative. Because Shigella and Salmonella both belongs to which family? Enterobacteriaceae. They belongs to which family, guys? They belongs to Enterobacteriaceae. That's why they will be catalase positive, but will be oxidase negative. And Vibrio cholerae is what? Catalase and oxidase both positive. Catalase and oxidase both positive. And on the MAC is what? MacConkey agar. On the MAC, non-lactose fermenting colonies are produced by this fellow also. It also produces non-lactose fermenting. Shigella also produces non-lactose fermenting. Okay. Regarding DCA, in that also non-lactose fermenting. But the difference is this time there is a black center. Whereas in the case of this particular one, that is XLD, there is without black center. And here in the DC also, there is without black center. Means Shigella is without black center. But Salmonella is with black. Salmonella, Salman, you have to put a black tika, that is in the center. The black center is there in Salmonella. XLD, the red colonies are observed with black center. XLD, the red colonies are observed with black center. So that is also there in the this particular Salmonella. I cut test here also you can forget upon, and you can agglutinate with what? Salmonella polyoantisera. So that is also available, polyoantisera. So agglutination is possible with Salmonella polyoantisera. So this is regarding the Salmonella. Okay. As far as some of the viral agents are concerned, you know the viral agents. The viral agents, I told you, the most important name in virus is rotavirus, the most common cause of watery diarrhea in the children. Norovirus, ship cruises, and if you want to remember adenovirus name also you can. And how to detect of the viruses, guys? So viruses are detected by electron microscopy. Simple. If you are so rich institute, that is AIMS and all, so electron microscopy will be there. And what you can detect of? The viral particles. Okay. Then the viral antigens can also be detected by the various ELISA methods which are available nowadays. And there is detection of nucleic acid, that is RNA, DNA, by what? PCR. PCR in the stool specimen. So there is that also. The detection of the nucleic acid by the PCR in the stool specimen. So wherever the virus comes, three things you can do. Either you can find directly the virus in the electron microscopy, or you can find the viral antigen, or you can find DNA, RNA. And nowadays, for everything we have what? That is the PCR. Okay, for everything what we have the PCR. Now the last thing here is regarding the intestinal parasites. Intestinal parasites, which associates with this dysentery and all those diarrhea stuff. Okay, some of the names and some of the features of them. Okay, I will tell you. Now, Entamoeba histolytica, the most common feature of what? Dysentery, most common cause as per the parasites. So this is the most common cause of dysentery. And when you go for the stool microscopy, what you will find in the patient in this stool microscopy, you will find the trophozoites. Okay, you will find the trophozoites. And what important thing regarding trophozoites? They have engulfed the RBCs. They have engulfed the RBCs. Means that particular procedure is termed as what? Erythrophagocytosis. What you call that particular thing? Erythrophagocytosis. Okay, if that is there, immediately your diagnosis of what will be made? Entamoeba histolytica. What will be made? Entamoeba histolytica. If you're able to observe what? Engulfed RBCs under the microscope. Okay. Other than that, in the parasites also, what you can go for? You can go for the detection of specific antigen. Like which one? The lectin in the stool. So various kits are available to find this lectin also. And you can find the trophozoite or quadrinucleate cyst in the stool. Okay, in the stool. Now, Giardia lamblia. Giardia lamblia, and as you can see, Giardia lamblia associates with steatorrhea, and it causes which sort of a diarrhea? Fatty diarrhea. Okay, steatorrhea you call it. Bulky stools. What is observed in this? That is the bulky stools. And what is there in this? The trophozoites you observe. Remember, guys, one thing that in the case of parasites, you make two types of mounts. One is saline mount and one is iodine mount. Saline mount is always made for trophozoites and iodine mount is always made for cyst. How we make it? We take the stool sample. In that you add 1 drop of saline. We take the stool sample on the slide and in that you add 1 drop of iodine and then you put the cover slip. And when you see under the microscope, you'll able to see the trophozoites and the cyst. And when you see the trophozoite here, you will see what? Teardrop. Tennis racket appearance. And how much nuclei there? Binucleated. It is trophozoites, teardrop, binucleated with how many flagellas? 4 pairs of flagella. This is also a question. 8 flagella or 4 pairs of flagella. That is there. And the cyst is tetranucleated, can be tetra, but mostly this also is binucleated, guys. This also is binucleated. And in the center, there is a structure which is present, and that structure is termed as what? Central exoneme or exostyle. Means in the trophozoite also, you observe the exostyle, and in the cyst also, you observe the exostyle. So remember like this, that the Giardia is stylish. Giardia is stylish. So that is regarding the Giardia intestinalis or Giardia lamblia. Trichuris trichiura. Trichuris trichiura, guys, is a what? Trichuris trichiura is a nematode. And this particular one associates with dysentery-like episodes sometimes. And it is having what? It is having barrel-shaped egg. What is barrel-shaped egg? Which looks like this, which looks like a dumbbell shape. Barrel-shaped eggs, okay, with mucus plugs. This is mucus plugs. And the egg is bile stained. Egg is bile stained means it is yellow. The egg is bile stained means it is yellow. So this is regarding the trichuris. Enterobius vermicularis. Okay, you must have heard of that the children they develop itching in the perianal region. It is due to Enterobius vermicularis. And guys, this question was asked in the NEET PG just now. In this concluded exam, this was asked. It can be asked in the form of MCQ in your exam also. That is a board exam. That is your professional. And in the night, the child scratches in this perianal region. And what happens? The eggs, they get into the nails of that fellow. And after some time, what you observe? The child have put the fingers in the mouth. So basically what happens in Enterobius vermicularis? Auto-infection. And which sort of egg is there? Plano-convex. Okay, not concave, plano-convex egg. That is there in this particular one. And inside, what is present? There is a tadpole-like larvae. So this plano, it looks like a D and it is termed as plano-convex. And the egg of this is not yellow. And that's why we call it as what? Non-bile stain. We call it as what, guys? Non-bile stain. So plano-convex egg, which looks like a D. Inside, there is a tadpole-like larvae. And this is non-bile stain. Okay. Now talking about the another nematode that is termed as Ascaris lumbricoides, which is also termed as roundworm. Okay. Malabsorption happens because of it. Malabsorption happens. And in the stool sample, what you will get? You can get 2 types of eggs. Fertilized egg, unfertilized egg. How you differentiate? This is proper shaped. Fertilized egg is having a proper shape. Whereas in the case of unfertilized egg, it is elongated. It is elongated. Okay, it is elongated. So these pictures of these eggs and all is there on my YouTube channel. You can go in my playlist and you can observe these particular ones. Okay, so unfertilized egg is elongated. Fertilized egg is having a proper shape. This particular one in the Ascaris lumbricoids, which is also termed as what, guys? Roundworm. Which is also termed as what? Roundworm. Okay. Now, hookworm. As the name suggests, hook-like structures are there, which attaches to the surfaces and bleeds. Bleeding happens. And thereby we say that in this hookworm infection, diarrhea can also happen and the blood loss, that is anemia. And regarding the eggs of it, the egg of this looks like this way. That is, there is segmented egg. Which sort of egg is there? Segmented egg. And it is termed as having the 4 to 5 segmentations. And those segmentations is termed as what? Blastomeres. Those segmentations are termed as what? Blastomeres. Strongyloids. Strongyloids stercoralis. This particular one also associates with diarrhea. And what you detect in the stool sample? Rhabditiform larvae in the stool microscopy that can be detected in the Strongyloids stercoralis. And Strongyloids stercoralis can be asked in the form of MCQ also. And it also associates with auto-infection. This also associates with what? Auto-infection. And that too, they will write up in the HIV positive and all. That too, they will write up in what? HIV positive and all. So guys, this short tabular form covers up the full GI infections in a very beautiful way. Okay. So do see this particular video once again and correlate what you have studied up. You will feel that sir have like concluded everything in these particular tables, which I have read after having 10 to 15 hours. Okay. So you will feel the difference, guys. And these are the various parasites which you have talked about. Some of them are protozoa. These are the protozoa and these are the helminths. Trichuris, Enterobis vermicularis, Ascaris, hookworm, strongyloids. And these are the important features of them because you should know that how their eggs look like. Okay, how their eggs look like and 1122 properties of every particular organism. You should have an idea. Okay, so by suppose you don't know anything about anything, so at least you can write something in the exam so that the passing marks might be awarded to you. So for today, this much, guys. These particular tables you revise up once after the session, after seeing the videos again, that how to find out the microscopy findings of intestinal parasites, what to look out for. In the viral agents, how to go for the lab diagnosis and how to go for the bacterial one and what all important properties I have to remember up regarding all of them, regarding the bacteria, regarding the virus, regarding the parasites. Is it fine? And along with that, we have talked about this particular thing, that is which one is non-inflammatory, which one is inflammatory. So this one can also help you in some way that in the non-inflammatory fecal leukocytes will not be there, in the inflammatory fecal leukocytes will be there. Okay. Other than that, this particular table, definitely one question is there in the form of case scenario, which is coming up in your exam. So at least you should have an idea for the important ones like Staphylococcus aureus, Bacillus cereus, that is less than 6 hours, 6 to this 8 to 16 hours and then more than 16 hours. So like that, you can remember of these particular things regarding the food poisoning, diarrhea, gastroenteritis, and dysentery. Is it fine? I suppose if you have read this and after that, if you see this particular thing, you will understand that what sir have told. Okay. So very best of luck and do subscribe up to our channel, that is DocTutorials once. And along with that, do take up our MBBS curriculum app. And if you are exam going and all, then you can tell up your juniors also because that will change somewhat their approach. You also have felt the same way that we have read, but in the end, we are not knowing what is bacteria, what is virus, what is parasite, and what is fungus. So that is very important to know. So if you know that particular one well, then everything will come from the mind. Okay. So thank you so much. Take care. Bye. Good night. I suppose this proves helpful.